We're going to wrap with this really, you had said revolutionary, I think was the word. So it's exciting to end on this. A small population of myeloid lymphoid neoplasms, MLNs, with very exciting news coming out. So what was that?
Okay, so very small group of patients with myeloproliferative neoplasms, which sometimes may also have at the same time what appears like lymphoma, myeloproliferative neoplasms and lymphoma together. That's why they're called myeloid lymphoid neoplasms. It's mixed bag. This type of patients are not very common at all, but some of them have a genetic abnormality that we discovered is the driving force behind it. The genetic abnormality is activation of certain gene. The gene activates the protein, like gene makes proteins, right? And this protein is called FGFR. FGFR, that's abbreviation, fibroblast growth factor. It's a protein, FGFR. Now, we have a pill that can inhibit FGFR and eliminate disease. Can you believe it? That has not existed in the past. This was very deadly condition. Myeloid lymphoid neoplasm with FGFR, life expectancy 1.5 years. Only way to cure the patients, maybe some intensive chemotherapy and do the transplant if you can. With the pill, you have a very, very high rate of elimination of the disease. We still want people to go to transplant because we don't know, is it going to work forever or what? But it's extreme efficacy with just one daily pill for patients with FGFR myeloid lymphoid neoplasm. Now, how do you recognize these people? The patients, right? That's the key usually. You know, when we analyze the bone marrow of the patients, we look how this looks like. Is it normal, abnormal size, shape, and colors? We look at the genes, mutations in the genes. We also look at the chromosomes. Chromosomes are finger-like structures inside the cells that carry genes. And it happens that this condition can be recognized by looking at the chromosomes. Every single patient has abnormality in chromosome 8. Well, maybe that's too much to take, but 8p11 is the code. 8p11, people call 8p11 syndrome, if you like, 8p11 disease. When this chromosomal abnormality is seen, that is indication of the FGFR-driven disease. So looking at the chromosomes, which is standard bone marrow type of a test, and seeing 8p11 abnormality in chromosomes, identify these patients, and you give them that pill, and it's a beautiful story after that. This was the best of ASH presentation, one of few, because it's altering the life of these people. Unbelievable.
That really is, it's incredible. Do you know how long the follow-up was of people in the study?
The longest one is actually my patient, the #1 patient on the study. It's 4 years now.
4 years.
Yeah,
Oh.
the patient was told to have life expectancy of 1.5 years before coming. And now it's 4 years without any evidence of the disease whatsoever. We still tell him, look, you should probably go to transplant. I don't really know whether this is going to work 10 or 20 years. I don't know what's going to happen tomorrow. But he's a young gentleman. He says, no, it's working 4 years so far. I don't want to do anything but continue to take the pills. So others are following. Some did do the transplant, some did not. We'll see what happens, but it's altering for many. It's amazing.
I mean, it's life-changing it's a game
Yeah.
changer. How much, I mean, obviously this takes more study before it goes to the masses, even though this is a smaller population. I mean, this is
I
phase
think
2.
because it's such efficacy that you don't see often, there is no need for any further studies. I would suspect that next year, the company behind this drug will apply for approval just on a sheer evidence of amazing result. And after all, we are not talking about extraordinary number of patients. To study it further would kind of provide unnecessary delay in having the pemigatinib
Right.
available for these people with 8p11 syndrome. Maybe a few hundred patients like this are seen in the United States a year.
That was my next question. So you said a few hundred. So really, truly a very small group of
Very
people.
truly.
Okay. What are some of the presentations because I know you can study the chromosome, at the chromosomal level, but are there different presentations in terms of symptoms or something?
Well, yeah, because it's mixed. Some people have enlarged lymph nodes, and people say, "Oh, you have lymphoma." Some people have even acute leukemia, uh, either the acute myeloid leukemia or acute lymphoblastic leukemia. Some people have just normal MPN, high white cell count and high platelets. You think it's maybe PV, but it's not. You do the bone marrow testing, you do the chromosomal analysis of chromosomes, which is standard. You see this abnormality there, and you need to remember, hey, this is not normal. What is this all about? And then you click and say, oh my God, I can cure that people.
That's incredible. That's a great note to end on.
Yeah.
Yeah, Dr. Verstovsek, I really appreciate your time. Is there any one last line you want to say to people in terms of the landscape of the emerging treatments for myeloproliferative neoplasms? And
So imagine that we talked about this 15 years ago, or even 10 years ago. There would be not much talk. The first ever medication approved for any of the MPN was ruxolitinib 10 years ago. And then about 5 years ago, the same medication for PV. Now you have fedratinib for myelofibrosis, you have ROPEC for PV, and you have all these phase 3 studies. Unbelievable. Unbelievable. So I invite everybody to join in the efforts to get many more drugs approved, make all these conditions as chronically possible, as I explained. If we cannot cure it, hopefully we will. But if we can, let's make it just livable forever.
thank you again so much. Really appreciate your expertise and your time to explain this for patients and their caregivers. Dr. Verstovsek, hope to have another conversation with you soon where we have another hour of new treatments and therapies and drugs to talk about. So thank you.
Thank you. It was a real great pleasure. Wonderful discussion. Hopefully very helpful to everybody.
I have no
Thank you.
doubt. And for everyone who wants access to this full conversation, just head to thepatientstory.com where you'll find human answers to your cancer questions.